Okay, a very good afternoon, and thanks to the AIOC for giving me this opportunity. To begin with my presentation, the first thing I would like to ask my dear friend, are you serious? Are we debating this? Well, if you are, let's move ahead. Have we heard of this terminology called bilateral endophthalmitis? If not, believe me, the books on cataract surgery will have this in the top of the list as bilateral endophthalmitis. If this is going to be the norms for cataract surgery, that is bilateral simultaneous cataract surgery, and the tagline remains in Indian scenario. This is going to be one of the dreaded complications which everyone is going to be aware of. Have you not heard of these paper cuttings that are going into different vitrectomies or losing sight? And it's these paper cuttings and news are going to be flooded if that norm is going to be advocated that bilateral cataract surgery should be the norm in future. Let us take this again. In spite of the best efforts, in spite of doing the best A scan, we do have refractive surprises. And believe me, my dear friend, who's such an expert cataract surgeon, I would not say 6'12", 6'9". He has the capability of doing a 6'6" part visual acuity patient for a cataract surgery because he's such an expert. And believe me, forget about endophthalmitis, just a small vitreous reaction and that 6'6" part patient going into 6'9" or 6'12", what are you going to explain? So it's better that we do sequentially. And let's talk of this Indian scenario. The surgeons doesn't scrub between the cases. Assistant does not scrub between the cases. OT fumigation is not done. Same machine and same equipments are used. Do the entire trolleys change between the surgeries? Even if we go for the simultaneous cataract surgeries, we might even have to shift the OT, which is not possible in Indian scenario. And look at if we have to go in for the camps, how are we going to counsel the patients to go for cataract surgery in a simultaneous way? Well, I am with my dear friend. If there are situations where you have to do for a pediatric cataract, bilateral hypermature cataract, or in patients who stay about 300, 400 kilometers away, we might even think of doing that, but not for all patients. Now, the big question which I would like to ask my dear friend, what if you need to operate on your parents or dear ones? Would you still prefer the bilateral cataract surgery, or would you wait for 24 to 48 hours and see the results in one eye and then go ahead with the second eye? So my point is safety first. You should think before you act. Thank you.